Welcome back to Mobility Agility Chiropractic Performance weekly live stream. I'm going to go ahead and get our video set up so that I can see your comments through tonight and let some people get on and get ready for our evening. I see we have Tim and Aeneas. Welcome this evening. Tonight is going to be a how to self-care, and as you can see, I have my ever-friendly house tigers running around in the background. They always like when I'm on the floor. But really, tonight is going to be about you and what you can do at home while we're still in this pandemic. Granted, I just got great news from our governor that they are going to start allowing elective procedures. And what that means is we can start seeing health and wellness patients, people who just want to get better, get back to performance. We no longer just have to see acute pain people. Yes, we can go back to full care with modifications to maintain social distancing and safety, but we can definitely get back to seeing people and taking care of them how they need to be taken care of and not having state restrictions. So I'm kind of excited about that. Now, let's dive into what you can still do at home. They're starting to sell instruments online for scraping, and I have two examples here. Both of these are Factor instruments. They're stainless steel, surgical grade. They are fantastic for some myofascial release. Really, they're starting to gear this towards, pardon me, how rude. They're starting to gear this towards athletes, anyone trying to be active and maintain a healthy musculoskeletal system. The issue with using this at home is really no one tells you how to do it. So let's go over some simple how to use a instrument assisted soft tissue mobilization device. I know, what a mouthful. Or IASTM, and go over how this can help your fascial train. So again, going back to what is fascia. Fascia is basically the cling film that surrounds our muscles. And this allows our muscles to glide back and forth because between the layers of fascia is hyaluronic acid, which basically provides a lubricant, or for lack of a better word, a butter. And there are times that can solidify and form bonds, and this creates pain and adhesions. So we want to make sure that we're kind of getting those things to slide back and forth and warm up the area. So this is really something you do with light pressure and really gently just kind of activate that area. So one of my favorite things to use is really any topical works. So a lotion of some sort. I personally really like Therapy Cream from Factor and China Gel. One, it smells delicious. It has some great herbal enhancements and arnica, which arnica helps bring additional blood flow to the area and feels really good and warming. So for me, I don't like getting it on my hand, so I'll wear gloves in practice, or I simply will apply it to the instrument and essentially butter myself up. Now, I'm going to be working on my shins because I've been walking a bunch on concrete recently and my shins hurt. And I'm not getting shin splints, but my tibialis anterior, that front muscle of my shin, not a happy camper. Now, what I'm going to do is I'm just going to gently, just the weight of the instrument. I'm not pressing down. I'm not indenting the skin. I'm just sweeping the area to see where I get any angry red areas. And I'm getting a little bit more discomfort on the side. So I'm just going to kind of focus into that area. And I'm just quickly going to scrape and free that up. And I'm getting a little bit of a line of red right down here It's really subtle. My leg isn't too bad because I do this quite regularly. And I'm just gonna quickly go up and down. I'm not causing any pain. It's like a 2 out of 10, really nice and gentle. Just kind of freeing that up. Now, if I really feel like right in here, I'm feeling a little bit of a sensitive spot, I can change what type of movement I'm putting into it, what type of stroke with the instrument, just to kind of focus into that area. But I'm just kind of loosening up and freeing up the tissue and then just letting it relax. Couple seconds, or like a minute, two. Doesn't take a lot of time. There's no significant bruising. There's no significant tissue damage. If you're walking away after scraping yourself and you look like you got beaten up, that can be too much. Now, there are places that just react more. Like if you work on your neck, that area, because there's a lot of vasculature, just reacts a little bit more aggressively and create some of those petechia and bruising and kind of looks like a hickey mark. And it can be just with like 2 or 3 passes. So watch your tissue, know what's going on. If you start to see significant bruising or any little purple dots, go ahead and stop, because the thing is, we don't want to cause more trauma and create more injury than what's already there. This is really just to loosen up the muscle. This is not to treat any specific injury. It's just to create some health and wellness for you. Now, some other options for what you can do is cups. Now, there are multiple different ways, from handheld cups that you push and suction on to ones that have a cupping gun to apply, to flame, to fire cupping. I don't do fire cupping. One, I'm a fire hazard in and of itself. I most likely would catch myself or a patient on fire. I don't want to deal with that, and it takes some additional training. So if someone is doing it, that's awesome because it does feel really good. I just don't trust myself to do it. Kick the cat, have a bunch of books fall over, is, let's see if I can't get that to, there we go, is stand up with the cups on, and I can simply do some calf raises just to kind of bring the muscle tissue in and out. If doing 2 calf raises is too much, you can do single leg, you can do stretching, you can simply walk with them on. This is another reason why I don't like flame cups. They're glass. They can pop off and break. But the plastic cups, if they pop off, it's no big deal. Now, this is anticipated that there's probably going to be some bruising, and it's kind of going to look like an octopus attacked my leg. So I simply watch and I look at the color of my skin in the cup, and I just watch it. If it's kind of this red, it can stay on. Generally, I don't keep them on past 5 minutes, but if it starts to get really dark and purple, I go ahead and take it off. I kind of bruise like a peach, so it's something I watch fairly closely so I don't look like I have gotten beaten up. The other place I like to use cups is on my back. Now, applying cups to my back, not the easiest thing, but it is something that my husband can help me apply. And then I do some yoga, so some cat-cow poses. So simply being on all four, doing some breathing, flexing in and out. I can also have him slide the cups up and down my back, which feels really good. And basically, you get a massage from your partner without them having to fuss about your hand hurting. And it feels amazing. So here's a way to cheat the system. Now, I'm going to show you my favorite piece of home rehab equipment. Absolute favorite. Can't go anywhere without it. Granted, when I'm at home, it gets stolen a bunch by my cats. The tennis ball. This is the best thing for your soft tissue when you're at home and you need to take care of yourself and you can't go see a massage therapist right now because of COVID. You can't necessarily go see your chiropractor because wellness has been canceled, but wellness is back in the schedules now here in Minnesota. This is the best thing you can do. And one of the areas that I like to use my tennis ball is my upper traps. I know for me, I hold a lot of tension right here. They can become essentially a ginormous brick wall that just are tight and uncomfortable. So this is how I treat it when I can't go see someone else. And all you have to do is lay down. So I'm going to treat my right upper trap. So I'm going to simply place this. I'm simply going to place it between my spine and my shoulder blade. So right here, I'm going to lay back. And then what I'm going to do is I'm going to turn my head away from the ball, lift my head up, raise my arm overhead. Whoo! Feel that muscle kind of dig in. And then I'm going to release it by reversing the movement. And I'm just going to do that a couple times. Now, this is a form of myofascial release technique, which is the generic brand of something that rhymes with it, that starts with an A that I can't say because I'm not trained. ART. So it's a great way to kind of create some release. So again, you have the tennis ball, you have it in that upper trap, you turn your head away from the ball, you lift it up a little bit, kind of tuck your chin in just to keep from over-engaging some muscles. Raise your arm up, really dig into that muscle and come back down. Now, if you do 4 on the right side, you got to do 4 on the left side to keep things even. The other place that this is great is into that kind of low back squish QL muscle. Ooh, this can be a great way to dig into it. Same with your glutes. Tennis ball is the magic weapon of home care that I absolutely adore. Beyond the cupping, beyond the instrument scraping, the tennis ball is your best friend. So is there anything that's bothering anyone that you want to have be shown how to treat it? Are you having neck pain, low back pain, knee, foot, ankle? Is there anything you need taken care of tonight that you haven't been able to see someone because we've all been at home? Because here is your chance to kind of find out whether it be foam rolling, whether it be cupping or scraping or the magic tennis ball. I am happy to show you what you need to kind of take care of yourself. Because here's the thing. If you're just maintaining your activity, maintaining your self-care at home, here are some great options. If you're injured or really looking at specific performance enhancement, then that's where you need to go in and see a professional. This isn't a cure-all. This isn't a fix-all. This isn't how to manage any specific one diagnosis. This is simply a way to alleviate some tension, alleviate some stress, and really take care of yourself. I have a question. What's the best release for a piriformis? Yay, piriformis, because that hurts. I'm going to use the tennis ball. Now, depending upon your mobility, you might have to make some modifications. especially if you are lacking in some knee mobility. So when you're missing some knee mobility and you're simply going to take your tennis ball, sit on it in the squishy part. Now, key things. Make sure you don't feel any numbness or tingling shooting down the leg. You potentially just put the tennis ball on your sciatic nerve. You don't want to do that. So adjust it so that it's just on the squishy. You can bring your knee in to whatever level. You can then turn your knee out and then bring your knee across. This is a way to kind of just release the piriformis without putting a lot of pressure on your knees. And you're just going to move that internal and external rotation to kind of create some of that MRT. Now you can hold it nice and slow in certain positions. So for me, as I turn my hip out, this is where it hurts the most. So this might be the position that I want to hold, maybe adjust and kind of roll over the tennis ball to best benefit getting that muscle to release. So like if I rock forward a little bit in that external rotation, then bring my hip into internal rotation, bring it back out, I'm starting to feel that muscle give way and release so that I'm going to have a little bit more range of motion. And ways to kind of check how this is feeling is to simply bring your knee in, see if you can relax it down any further. Ooh, it's a little tight right there. So definitely going to kind of keep working through that. And again, simple tennis ball. You can use a foam roller to kind of foam roller it, but I really like the pinpoint specificity of the tennis ball. Granted, if you have someone else that can work on it, they can simply put their elbow in your piriformis while you're laying on your tummy and move your leg back and forth, because you're really looking at working on the piriformis muscle, which runs right here under the glutes. So it's a deep, deep glute muscle. And again, that sciatic nerve can run right through it. So it can create sensations of numbness, of numbness and tingling running down the leg. That's nothing to do with the back, nothing to do with discs. It can purely be a muscle in that glute just angrily on that sciatic nerve. So using a tennis ball to release it is a great way to kind of create that mobility. And again, you don't have to contort into any position. You can just use a simple internal, external movement. Again, for me, the external is definitely where I'm feeling much more sticky, not as flowy, and a little more discomfort when it comes to moving through that piriformis. But it might be a different position for you. This is not a catch-all, everybody's the same. You have to kind of play with the modifications to see what works best. So are there any other questions for muscle releases, for pain and discomfort, or frankly, do you have any questions concerning any medical topic that you just have a burning need to have answered tonight on our live stream? If there is a specific topic that you're curious about, go ahead and comment below whether you watched it #live or #replay. I would love to be able to answer those. If it's a topic we definitely haven't covered, it will become the topic for next week, simply because I want to make sure that these are tailored to the people who attend. I want them to be a benefit to you as you take care of yourself, because really here at Mobility, Agility, Chiropractic Performance, it's all about getting you better and keeping you better longer. And I want to provide the resources that help you take care of yourself. Now, no one's asked it, but I definitely know for me, recently, from working at home on a laptop, I've been having some definite forearm tension when it comes to typing. So I'm just going to roll up my sleeve. I'm going to work on my left arm simply because I'm right-handed and I can do it with a little bit more grace than if I were working on it left-handed. And so I'm going to make a bunch of noise. So for the forearm, this is something that I like to apply a little bit, then press down, and I'm simply going to hold while I move my arm back and forth. Now this is simply so that I can find the most tender point and then just kind of release it. So again, you start with a gentle scrape. I kind of know where my area of owie is up here, right at the origin of my wrist extensors, which simply means the muscles on the back of the arm make my wrist go up. I'm going to scrape that out. You can kind of see right in here, if you can get past the shiny, maybe, that this has definitely gotten much more red, much more angry than when I started. Again, light pressure. I'm never really letting the pain go above or discomfort above a 2 or a 3. You don't have to grin and bear it. This is, again, pull the hand back and forth, just letting it kind of move and relax and release. You can also add weight if needed. You can add some additional stretch from your hand. It overall just kind of feels really good. If it's not quite positioned on the right place, you can slide it into a different position. Again, just to hit the point that is most uncomfortable for you. And then you can leave it on and just kind of watch as the color changes to see when you need to take it off. Now this is kind of interesting. Typically underneath the cup is a perfect dome. And I'm seeing that right here on the inner edge, it's got a little divot in it. It's subtle, but that probably means there is some significant tacking down of the tissue that I wouldn't expect to be there. So I'm actually going to leave this on. Maybe not. I'm going to leave it on for a little bit and just kind of let that recover and let that tissue shape normalize a little bit, just to kind of help keep my forearms healthy. Because as a chiropractor, I have to do a lot of hand and arm care just to make sure that I'm healthy enough to treat you. So with that, I'm going to go ahead and leave you for the evening. I hope this was beneficial for learning how to do some home care activities. Basically, anything that I used here, minus the cream from China Gel, can be purchased on Amazon. Factor instruments are provider only, but you can find an off-brand something on the Amazon. Pretty much everything is on Amazon now, let's just be real. So these are some great options for you to take care of yourself and manage some of your less than comfortable situations to hopefully tide you over no matter where you're located and be able to see your preferred provider. Now, have a wonderful evening. Stay safe at home. And remember, here at Mobility Agility Chiropractic Performance, we're always trying to get you better faster, keep you better longer, because no one has time to be sidelined. Have a good night, and we'll see you next week.
To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.